The story of the Clara Duvall Reproductive Freedom Project began in 1929 when a Pittsburgh mother of 5 died from a self-induced abortion, leaving 5 children motherless. Before she died, she told her eldest daughter, 10-year-old Eleanor, "You will be the mother now." Younger sister Lynn Duvall Harwell would go on to found the Duvall Project, but before that happened, the landscape changed a lot for women in the U.S. The approval of the birth control pill was credited with the beginning of the sexual revolution and women's equality movement. The Supreme Court established married couples' access to birth control. Federal funding for family planning services began under President Richard Nixon. And in 1973, the Supreme Court ruling of Roe v. Wade legalized abortion. But in 1974, in Pennsylvania, the Abortion Control Act added sweeping restrictions on abortions, including a 24-hour waiting period and notification of husbands. The Hyde Amendment, still in effect today, allowed states to deny poor women Medicaid funding for abortions. In 1979, Pennsylvania NARAL leader Babette Josephs heard Lynn Harwell speak about the tragic loss of her mother, Clara Duvall. Together, they founded the Clara Duvall Education Fund. They had their work cut out for them. Ronald Reagan's election was a boon for the anti-choice movement. The Silent No More radio campaign blanketed the airwaves in Philadelphia with anti-choice messages, and the anti-abortion film, The Silent Scream, was widely shown in Catholic schools across the country. The growing power of U.S. anti-choice groups was felt worldwide when the global gag rule denied federal funds to organizations that provided or counseled women about abortion in the U.S. or abroad. In Pennsylvania, the Republican legislature voted to end Medicaid funding for abortion, and in 1 year, the number of abortions went down almost 10%. To counter anti-choice rhetoric, the Duvall Fund blanketed the state with stories about women's abortion experiences. In the same year that Randall Terry founded Operation Rescue, the first March for Women's Lives drew over 80,000 pro-choice supporters to D.C. In Pennsylvania, Duvall was busy conducting skills-building workshops for activists and politicians, which helped to unify and expand the state's pro-choice movement. In 1988, when Operation Rescue staged a massive disruption of clinics in the Philadelphia area and over 3,000 anti-abortion activists were arrested, Duvall organized a public religious response. In the following years, Duvall trained over 500 clinic escorts and 250 activists and speakers. Women's options continued to grow. RU 486 was approved by the French government, giving women access to non-surgical abortion. Duvall organized a conference to place pressure on the FDA to approve RU 486. It would not be approved in the U.S. until 2000. To counter misinformation about abortion, Duvall published a series of fact sheets and coordinated the Teen Access Coalition to get accurate information to teens and providers. Duvall also launched an ad campaign on buses in Pittsburgh proclaiming, "When abortion was illegal, women died." In 1992, the Supreme Court upheld most of Pennsylvania's Abortion Control Act. 3 restrictions: the 24-hour waiting period, parental consent for minors, and so-called informed consent were allowed. Husband notification was the only provision that was denied. But the same year, pro-choice advocates saw hope in the election of President Clinton, and on his second day in office, he lifted the global gag rule. Duvall began to direct educational campaigns towards minors and helped launch a teen pregnancy hotline. To promote it, they aired radio PSAs and distributed 40,000 stickers across Pennsylvania. Anti-choice rhetoric became more violent, and in 1993, Dr. David Gunn and escort Jim Barrett were murdered in Pensacola, Florida. In response, President Clinton signed the FACE Act, making it illegal to block clinic entrances. That year, Motherless, a documentary chronicling Lynn Harwell's loss of her mother, was completed, and Duvall hosted the premiere. Over the years, Duvall has distributed this powerful organizing tool to universities, medical and law schools, and advocacy groups nationwide. Recognizing a looming shortage of abortion providers, Duvall organized the Medical Training and Advocacy Initiative. In 1995, when 2 clinic workers were murdered and 5 wounded in Brookline, Massachusetts, Duvall co-founded a national coalition to combat provider shortage and produced a brochure to support medical students seeking abortion education. Duvall firmly established the lack of opportunities for residency training for abortion providers. Duvall took a leadership role in helping medical students establish chapters of Med Students for Choice, and chapters were established at 6 out of 7 medical schools in the state. In 1999, the FDA, with the urging of Dr. Susan Woods, approved the first birth control product for use after unprotected sex. Duvall produced and distributed 10,000 brochures to get the word to women and girls. And in the year 2000, a strong future was secured when Duvall merged with the ACLU of Pennsylvania. Access to EC remained a key issue. A Duvall survey of Pennsylvania hospitals launched a decade of activism on behalf of sexual assault victims' access to emergency contraception. Duvall developed a website giving victims a chance to tell their stories and raise visibility about the issue. The reproductive rights movement continued to face new political challenges. In 2001, Duvall organized a meeting of sexual assault and pro-choice advocates and legislators from 15 states to discuss how to move forward with EC in the ER. That same year, a medical student, working with Duvall, surveyed Pennsylvania pharmacists to determine their knowledge about emergency contraception. Her published results were cited in the FDA hearings about making Plan B over the counter. Combining its medical and legal expertise, Duvall published a training manual for healthcare providers treating minors. In the following years, a growing number of grand rounds and medical school classes focused on minors' rights. Duvall was an integral part of a New York and Pennsylvania program where primary care doctors were trained to perform early abortion services at outpatient offices. The ACLU was one of the national co-sponsors of the historic March for Women's Lives, where Lynn Duvall Harwell told her story to the hundreds of thousands gathered in D.C. Duvall produced materials about emergency contraception for sexual assault victims and, with Physicians for Reproductive Choice and Health, published materials about minors' rights. Concerned with the rising tide of abstinence-only programs in Pennsylvania, Duvall and partners formed PARS. And on the national front, the ACLU sued the federal government to stop their funding for the Silver Ring Thing, a religious, abstinence-only until marriage program. In Pennsylvania, despite the best efforts of pro-choice advocates, abstinence-only funding rose, with no funding for comprehensive sex ed in the public schools. And for the first time in over a decade, teen births were on the rise. A Pennsylvania bill to make emergency contraception available for victims of assault failed, but the Department of Health passed a regulation requiring almost all hospitals to provide information and access for those patients. In 2009, a new president brought hope for reproductive justice advocates. Enormous strides have been made. Under pressure from groups including Duvall, Pennsylvania Senator Arlen Specter put in no earmarked requests for abstinence-only programs. And in a stunning turnaround, Obama's budget eliminated funding for all abstinence programs and included $99 million to teach science-based sex education. In Pennsylvania, the PARS Coalition, which Duvall co-chairs, organized a lobby day in Harrisburg to push for 2 bills promoting better sex education. With leadership by the ACLU, Pittsburgh schools eliminated abstinence programs and voted for comprehensive sex education. 10 years ago, 28% of hospitals in Pennsylvania provided EC to victims of sexual assault. Today, that number has reached 78%. 30 years after the founding of Duvall, challenges persist. The young women you see here are just some of the interns and staff that Duvall has mentored and launched as activists and leaders to promote reproductive freedom in today's changing political and medical landscape. With their dedication and yours, the Clara Duvall Reproductive Freedom Project continues to pursue its core mission, mentoring the next generation of leaders and seeking reproductive freedom for all.